Welcome, everyone. Today we're talking about preventing falls and why this matters so much for older adults and the people who care for them. Falls are not an inevitable part of aging. Most falls can be prevented when we understand the risks and take practical steps. Falls are also a major cause of injury in older adults, so this is not a small issue. It is something that can affect safety, confidence, independence, and quality of life. The first step in fall prevention is knowing the risk. Falls usually do not happen for just one reason. Often, several risks come together. Poor balance can increase the chance of losing stability. Weak muscles make it harder to recover if a person stumbles. Some medications can affect alertness and balance. Vision and hearing problems can also contribute, and of course, unsafe home environments can create hazards. We also know that falls are common. About one third of adults over 65 fall each year, and many fall more than once. That tells us we should not ignore early warning signs. Movement is one of the most powerful tools we have. Exercise helps with balance, strength, and flexibility. All three are important in fall prevention. Balance work might include standing on one leg or Tai Chi. Strengthening can include things like chair squats or resistance bands. Flexibility can be supported through gentle stretches and regular walking. The message here is simple: movement matters. In fact, regular exercise can reduce falls by up to 30%. That is a very meaningful difference. The home is one of the most important places to focus on. More than half of falls happen at home, so small changes in the environment can make a big difference. Clear pathways by removing clutter, cords, and loose rugs. Add safety features such as grab bars and stair rails. Make sure there is proper lighting, especially in hallways and at night. Use non-slip surfaces, particularly in high-risk areas like the bathroom and the kitchen. A safer home reduces risk and also helps daily life feel easier and less stressful. Medication review is another key to fall prevention. Some medications can cause dizziness. Others can cause drowsiness, confusion, or drops in blood pressure. Any of these can increase fall risk. That is why medication should be reviewed regularly, ideally every 6 months. Caregivers should also watch for side effects and report concerns. Sometimes the medication itself is not the problem, but the combination of medications can still affect balance and alertness. Health checks are very important. Vision checks can help identify depth perception problems. Hearing tests matter too, because inner ear problems can affect balance and dizziness. Physical exams can detect blood pressure changes and other medical issues that may increase fall risk. The evidence here is striking. Vision impairment can double fall risk and hearing loss can triple it. So, routine health checks are a practical part of prevention, not just general maintenance. Assistive devices can help a lot, but only when they are used correctly. Walkers and canes should be properly fitted. People should be taught the right technique for using them, ideally by a therapist, and the devices need regular maintenance, such as checking the rubber tips and brake cables. When mobility aids are used correctly, they can cut fall risk in half. That means the device is not just something to have, it is something to use well. Caregivers play a major role in fall prevention. They can encourage activity and support healthy routines. They can monitor medications and watch for side effects. They can do regular safety checks of the home, and they can offer support in a way that protects dignity while still improving safety. This balance is important. We want safety, but we also want to preserve as much independence as possible. Programs that involve both the caregiver and the older adult tend to be the most effective because fall prevention works best when everyone is involved. Falls are common, but they are not inevitable. When we understand the risks, support movements, improve the home environment, review medications, keep up with health checks, use assistive devices properly, and involve caregivers, we can reduce risk in a very meaningful way. The goal is not only to prevent injury, it is also to preserve confidence, independence, and quality of life. For practical support, helpful handouts, caregiver guidance, and conversations that make care feel more manageable, join the Care Caribbean community. Inside, you will find resources, talks, and support for dementia care, safety, caregiving, and daily life. Join by scanning the barcode or using the link below.